that I'm not the most interesting talk, but I will try to warm up a bit. So I'm Marc Baguelin. I'm working here at PhD, and the theme of the symposium is the impact of mathematical modeling of influenza. And the aim of what we're doing is to take better decisions for public health. So I'm going to give a bit introduction, trying to narrow down what we're interested in, because the theme of mathematical modeling of infectious disease is very wide. And I think there's two main drivers, I would say. One is what I call the academic driver, and the other one is the kind of public health driver. So these two have different goals. So in theory, the academic drive is to make scientific knowledge progress. So that should be the kind of aim of it. And for the public health, it's to protect people from infectious disease, to improve their health. And this leads to, I think, different incentives in these two drives. One is for the kind of academic driver. I think it's mainly you want status progression and grants through publication in high-profile journals. So I mean, obviously, this is on top of trying to progress knowledge. And in public health, you have more imperative of having something which is directly applicable for decision taking. That means that maybe the thing you really care is that policymakers can take decision on what you're doing. And in both cases, I mean, this is obviously a bit of a caricature, but in both cases, you have model development is subject to time constraint and pressure usually. And I would say that this is kind of the two main forces, I think, but particular disease will usually be a component of these two forces. So what I'm going now to try to narrow down what we're interested in this symposium. I think you have different models, and these different models, style of models, leads to different metric. So first metric, I think, is kind of utility, but I'm not going to define. And the other one is sexiness. So that I'm going to define because it's a bit subjective. So I think a sexy model can be real advanced to knowledge. Some argue that it's not the main one. Sometimes you have things like fancy colorful graph. For some reason you have the same model, but one has kind of had a better visualization, and apparently the model with better visualization appear nicer. Buzzword, and so if you manage to get a paper when it's kind of in fashion, it's more likely to for example, publish in high-profile journal. And the last one, I think, is probably one of the main drivers, is novelty. So when you write in your paper with use novel methods, and you feel like you're kind of advancing in the virgin land of science, that it's nice. And that means that I would argue that most of public health models are on this kind of axis. That means that they're trying to get as useful as possible, and they don't care too much about the sexiness. On the other side, the academic model would be on this axis. They try to be seen as sexy as possible, and the reason is basically because of the incentive, because you want to get published in high-profile journal. You want people to acknowledge that this is a metric, I would say. And what happens with time is that some of the model, obviously, if you add heterogeneities, or you translate outputs, or you adapt the questions, some of these methods might actually be seminal and kind of be useful for public health. I think I'm looking at the metric of utility. I'm not saying that this sexy model might actually progress science and might be very kind of useful in this way, but they might not kind of directly save life, for example. The other, with time, I think if you incorporate more data sources, more realistic mechanism, I think public health model can also be sort of interesting, intellectually challenging, and kind of sexy. And obviously, why I draw this little graph is that what we're interested in the symposium is this area. So I mean, you can see that we accept all kinds of sexiness. I mean, some even models which are a bit ugly, but we we are focused on the utility. So that's to narrow down. So in theory, all the model presented should in some way progress public health, save life, or improve health. Okay, so that's what we're looking for, a model of infectious disease. And now the last thing is why flu, and I will finish then, and I will let real talks on science. And so why flu? I think why flu is so important in modeling of public infectious disease. I think there's flu is at the same time ubiquitous, so you can find it everywhere in all countries, low income, high income country. At the same time, you've got the pandemic risk, so it's kind of there and not there at the same time. You're waiting for it, so it's kind of a bit mysterious. There's a high burden, and it's in every year. I mean, it's people dying, but it's also in the I would say collective memory with events like the 1918 pandemic, which is kind of the event in terms of if you're talking about public health threat, I would say. And then you've got something which is kind of, I think, challenging for intellectually, is that flu involves many simultaneous process over several scales. So if you want to control flu, you have to have to be able to kind of understand these different scales and combine them. And I think it will be kind of give you an idea of the diversity of the scale and processes involved in flu, and it kind of reflects the diversity of the talks later. So you've got all these events are happening more or less at the same scale. And so variation, for example, I would say that the typical scale would be months. I mean, you can have years, but I mean, you can see change in months. Immune response, I would say, I mean, it's difficult to give a precise time scale, but just to give you an idea. Immune response, if it's a short-term immune response, can be days, but usually it's more like weeks. Disease dynamics would be weeks. Change of behavior, weeks as well, and decision is usually weeks as well. So you can see that all these kind of time scales are colliding, and that's, I think, makes flu particularly interesting. So I will give a few acknowledgements first, and then I will let the real talks start, starting with Stefan, which I think is very eager to start, looking forward. So I would like to thank first the NIHR through the Modeling, Respiratory and Immunization HPRU to have made this symposium possible and to have funded the lunch as well. Contributing to this review and the talks, there's some people which are going to talk, but some people have contributed through giving article, commenting article, which they thought were the most important papers in the field. So there's I will read them very quickly. Katie, Rose, Stefan, Thibaut, Petra, Adam, Lula, Nim, Anne, John, Dominic, Edwin, Eric, and Sean. And in particular, I would like to thank for the organization as well, Una from the Respiratory Disease Department, which was very useful. And I mean, these people are really excited, but they not only contributed scientifically, but also with the organization, Petra, Edwin, and Dominic. Okay, so now I welcome again, and I will let Stefan open the science. You're here. Okay.